From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast. Over the past 8 months, we've had an incredible group of guests from within and outside the Rectangle Health organization, and today is no different. I'm excited to introduce you all and welcome Amaris Conerty, Practice Solutions Consultant at Rectangle Health, to the show to discuss how patient experience expectations pre, during, and post-care have evolved and how providers can meet them. Amaris, thank you so much for taking the time. Happy to have you on the show.
Thanks so much, Gary. So happy to be here with you.
Of course, and my pleasure. So let's get into it. You've been with Rectangle Health for 3+ years now and came on board at a challenging time, to say the least, at the height of COVID. Can you sort of take me through the biggest differences you see in the way practices manage their day-to-day on day one of your time here versus now? What would you say has changed?
Yeah, I have seen a huge shift in practices becoming more digital, more contactless, and having more flexible options available from them to their patients to engage with them, to be able to collect payments from them, and just overall provide a safe environment, a contactless environment. So I've really seen a shift in the mindset to become more technologically advanced at the practice.
I'm looking at a stat right now that says that nearly 80% of consumers prefer to pay medical bills digitally. And I know many practices still use paper statements, spend time following up, and eventually capture those balances due. But operationally, the longer a balance stays in accounts receivable, the more it costs the practice to get paid, right? In time, in money. What would you say to a practice with a more traditional approach?
You hit the nail right on the head, Gary, as you usually do.
Thank
Um,
you.
Even speaking from personal experience, when a provider will send me a physical bill, between chasing after my 15-month-old and managing day-to-day meetings and just life in general, trying to get to that and making a payment over the phone and trying to catch the office when they're so busy throughout the day as well, managing and juggling all of the things on their plate, it really is critical at this point to have a digital way of collecting payments, whether that's a compliant card on file with the pre-authorization that Rectangle Health obviously offers to our clients to be able to do, being able to send a text message. We know that 98% of text messages are open in the first 2 minutes of receiving them, and it's a huge game changer for practices to collect payments and reduce the time and money spent on billing by sending paper statements or even making phone calls to collect over the phone that way. And then also just being able to have a payment button on your website that if you're closed, your bank account is still open to receive payments from your patients by being able to go online, even if it's leaving a voicemail, letting them know, hey, this is about your bill, go ahead and pay it online, and having patients have that opportunity to do that. So it's a huge game changer. And that's definitely something that I would share with those more traditional practices in how they can change things up and make the payments rain.
That's a perfect segue because I wanted to shift gears, moving off payments to scheduling, reminders, and that's all a part of communication between practice and patients in general. You mentioned already within the first 2 minutes of receiving a text is opened. So how can a staff do communication, scheduling, reminders better and more effectively, especially nowadays with staffing shortages, employee burnout, and high employee turnover too?
Yeah, absolutely. Again, turning back to what I've seen since the height of COVID and since working with Rectangle, just the shift in this mentality to become more digital, to have more advances. So I'm so excited that Rectangle has not only developed and enhanced this award-winning payment solution to help practices, but we've invested in other resources to help continue to simplify the business side of healthcare and automate those processes for practices, especially for the ones that are short-staffed, especially for the ones that have a million and one other things to worry about throughout their day. So making sure that you have automated appointment reminders, auto filling of a schedule, being able to have mass messages go out to your patients that you have an announcement that there's a closure or a schedule change, or having a wait list and having that management to be able to prioritize your patients so that they can be on that list if there's a last minute cancellation. Having that process automated through our solutions that we've invested in, like Rafe Point, Reminder Call, again, making that more digital, having that integration with your current with their current practice management software, is again a huge game changer. You'll hear me say that a lot because it really is exciting to see how it's helped and benefited the practices that I've had an opportunity to work with.
Game changing is something that's very often heard here at Rectangle Health nowadays. So it's the enhancements certainly speak for themselves. So let's get into the execution portion. And you mentioned automation. We're talking about taking manual tasks and automating, simplifying the complex to save time, energy, money. If you were an office manager or a practice owner, or vetting out software to help with payments, communication, compliance, what are the must-haves and key considerations on your checklist?
One of the key considerations for me is definitely consolidation. How can I simplify the bills I pay, the people I'm working with, the support I have, and the integrations that are possible to one vendor? And again, as we've evolved since 2020, I'm so excited that Rectangle Health can be that holistic ecosystem where not only do we have, again, that award-winning payment solution, an integrated payment solution, but we now also have the integrated engagement, patient communication tools, and appointment reminders, waitlist management, in addition to helping simplify and manage and maintain compliance needs when it comes to HIPAA and OSHA too. So consolidation is key for me, and it has been for a lot of the clients and practices I've had an opportunity to work with.
Yeah, that's another big buzzword in the industry, in healthcare and outside of healthcare as well, as consolidation. And I love what you said about evolving with patients and meeting their needs, but also evolving with the provider and meeting their needs. Can you sort of give me some of the aha moments or the wow moments you've heard from practices who onboard this, you said, award-winning solution? This, in reality, it's a digital set of helping hands.
Yeah, the biggest aha moments I've had are just the amount of time that's put back into my office manager's day, the weight that's lifted off of their shoulders, especially dealing with short-staffed issues, right? I hear
Yeah.
that's one of the biggest obstacles that practices are facing is just the people that don't want to work, or if they're there, training them on things. So having something that's user-friendly in place, that's really easy to navigate and be able to manage the different tools to provide flexible options to their patients, whether that's collecting payment or it's engaging with them, automating that appointment reminder, appointment confirmation, waitlist management, and calendar scheduling management piece of the puzzle. And even when it comes to HIPAA and OSHA management and maintenance at the practice, being able to automate that and have that, again, burden lifted off of their shoulders to continue to put more time back into their day. That's got to be one of the biggest aha moments in the consolidation, in the automation, in everything that we provide to practices, is just how excited my office managers are to have more time put into their day to focus their attention on other tasks, because we truly simplify the business side of healthcare for them.
So for a practice or an office manager or an owner, whoever listening in today, how can they get in touch with you?
Yeah, they can certainly email me, give me a call. They can catch me on social media, LinkedIn. I'm always happy to engage however is most convenient, right? There's so many ways available to us. So being able to leverage any and all of them is key.
Absolutely. I'll drop your profile links in the episode description below. And I have to say thank you so much again for taking the time to do this. I know how busy you are, and I appreciate you being here, and hope we can chat again real soon.
Awesome. Thanks so much, Gary.
Pleasure. For our audience tuning in before we wrap up, don't forget to like, subscribe, and leave your feedback on this episode and what you'd like to hear discussed on future episodes of the Modern Practice Podcast. We'd love to hear from you. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event